Welcome to a deep dive into Whipple's disease, a rare and complex systemic illness that primarily affects the digestive system. Join us as we unravel the mysteries of this condition, exploring its causes, symptoms, diagnosis, treatment, and more. At the heart of Whipple's disease lies a bacterial culprit, Trophima whipplei. This bacterium, although common in the environment, only triggers the disease in a small fraction of exposed individuals. The exact reasons why some develop the disease while others don't remain unclear, but researchers suspect a combination of genetic predisposition and immune system deficiencies plays a crucial role. The pathophysiology of Whipple's disease is a fascinating yet intricate process. Trophima whipplei bacteria invade the lining of the small intestine, specifically the lamina propria. This invasion leads to the formation of characteristic foamy macrophages packed with bacteria. These macrophages disrupt the normal function of the intestinal villi, impairing the absorption of nutrients, particularly fats. The infection can also spread beyond the intestines, affecting other organs such as the brain, heart, lungs, and joints. Whipple's disease is a rare condition, with an estimated incidence of only about 1 in a million people. It predominantly affects middle-aged white men, typically between the ages of 40 and 60. However, cases have been reported in both sexes and across various age groups and ethnicities. The signs and symptoms of Whipple's disease are diverse and often non-specific, making diagnosis challenging. The most common symptoms include abdominal pain, diarrhea, weight loss, and joint pain. Other symptoms may include fatigue, fever, skin hyperpigmentation, swollen lymph nodes, and neurological manifestations such as cognitive impairment, seizures, or movement disorders. Because of its wide-ranging symptoms, Whipple's disease is often referred to as the Great Imitator. Diagnosing Whipple's disease requires a combination of clinical suspicion and laboratory testing. The gold standard for diagnosis is a small intestinal biopsy. Microscopic examination of the biopsy tissue reveals the characteristic foamy macrophages packed with Trophima whipplei. A periodic acid, Schiff-Passa stain, highlights these macrophages. PCR testing can confirm the presence of Trophima whipplei DNA in the biopsy sample. Other tests, such as blood tests and imaging studies, may be used to assess the extent of the disease and rule out other conditions. While Whipple's disease doesn't have distinct classifications or types, the extent of organ involvement can vary significantly between individuals. Some patients may primarily experience gastrointestinal symptoms, while others may have prominent neurological or cardiac manifestations. Therefore, treatment approaches are often tailored to the individual patient's specific needs. The cornerstone of treatment for Whipple's disease is long-term antibiotic therapy. Antibiotics such as ceftriaxone, penicillin, or doxycycline are commonly used to eradicate the Trophima whipplei bacteria. The initial phase of treatment typically involves intravenous antibiotics for 2 to 4 weeks, followed by oral antibiotics for at least 1 year. Regular monitoring is essential to ensure the effectiveness of the treatment and to detect any signs of relapse. Nutritional support, including vitamin and mineral supplementation, may also be necessary to address malabsorption. Unfortunately, there's no known way to prevent Whipple's disease. Because the exact transmission route of Trophima whipplei is not fully understood, specific preventive measures are difficult to implement. Maintaining good hygiene and a healthy immune system may offer some protection, but further research is needed to develop effective prevention strategies. With prompt diagnosis and appropriate antibiotic treatment, the prognosis for Whipple's disease is generally good. Most patients experience significant improvement in their symptoms and can achieve long-term remission. However, relapse can occur in some cases, highlighting the importance of ongoing monitoring. Recent research has focused on improving diagnostic techniques, identifying genetic risk factors, and developing more effective treatment regimens. Studies are also underway to investigate the role of the immune system in the pathogenesis of Whipple's disease, which may lead to novel therapeutic strategies in the future.